The third week of pregnancy marks the beginning of an incredible journey towards motherhood. At this stage, you may not even know that you are pregnant, but there are some changes happening inside your body that will lay the foundation for a healthy pregnancy. In this video, we will explore what happens during the third week of pregnancy, what you can expect, and how you can take care of yourself and your growing baby. Thank you so much for tuning into our videos. We notice that only 2.1% of our audience is currently subscribed to our channel. If you're enjoying our videos and find them helpful, we encourage you to hit that subscribe button and turn on notifications. It only takes a few seconds, and it means the world to us. Highlights of one's second and third week of pregnancy. First week. The first week of pregnancy is actually the week of your last menstrual period. The uterus begins to prepare for the potential implantation of a fertilized egg by thickening its lining. Ovulation has not yet occurred, and conception has not taken place. Second week. This is the week of ovulation, when an egg is released from the ovary and travels down the fallopian tube toward the uterus. If sperm is present and fertilize the egg, it will implant itself into the uterine lining and begin to grow into a fetus. At this point, the fertilized egg is called a zygote. The zygote begins to divide into a ball of cells called a blastocyst. Third week. The blastocyst continues to implant itself into the uterine lining. The embryonic period begins, and the blastocyst starts to form into an embryo. The embryo consists of 3 layers of cells that will eventually develop into the baby's organs and body parts. Some women may begin to experience early signs of pregnancy, such as implantation bleeding, mild cramping, breast tenderness, or nausea. What happens during the third week of pregnancy? During the third week of pregnancy, your body is preparing for ovulation. This is the process where your ovaries release an egg that can be fertilized by sperm. If the egg is not fertilized, it will disintegrate and be absorbed by your body. If the egg is fertilized, it will travel down the fallopian tube and into the uterus, where it will implant itself in the uterine lining. Once implantation occurs, your body will begin producing the pregnancy hormone HCG, human chorionic gonadotropin. How can I confirm my pregnancy in third week of pregnancy? Most home pregnancy tests are designed to detect the presence of the hormone human chorionic gonadotropin, HCG, which is produced by the developing placenta after implantation has occurred. At this point, HCG levels are typically still too low to be detected by a home pregnancy test. However, if you suspect you may be pregnant, you can keep track of your menstrual cycle and look for early signs of pregnancy, such as implantation bleeding, mild cramping, breast tenderness, or nausea. These symptoms may not be noticeable in all women, and some women may not experience any symptoms at all during the early weeks of pregnancy. What are some common concerns during the third week of pregnancy? During the third week of pregnancy, it's common to have concerns about the health of your developing baby and the progress of your pregnancy. Here are some common concerns that women may have during this stage. Miscarriage. Miscarriage is a common concern during the first trimester of pregnancy, and many women worry about the risk of losing their baby. While miscarriage can occur at any stage of pregnancy, it is most common in the first trimester. However, most women who experience miscarriage go on to have a healthy pregnancy in the future. Ectopic pregnancy. An ectopic pregnancy occurs when the fertilized egg implants outside of the uterus, usually in the fallopian tube. This can be a serious and potentially life-threatening condition that requires immediate medical attention. Chemical pregnancy. A chemical pregnancy occurs when a fertilized egg implants in the uterus but does not develop properly. This can cause a positive pregnancy test, but the pregnancy will not progress. What can you do to promote a healthy pregnancy during the third week? During the third week of pregnancy, there are several things you can do to promote a healthy pregnancy. Take a prenatal vitamin. Taking a prenatal vitamin that contains folic acid is important for the early development of your baby. Folic acid can help prevent neural tube defects, which are serious birth defects that affect the brain and spinal cord. Eat a healthy diet. Eating a healthy diet that is rich in fruits, vegetables, whole grains, and lean protein is important for both you and your baby. Avoid foods that are high in sugar, fat, and salt. Exercise. Exercise can help improve your overall health and reduce your risk of complications during pregnancy. However, it's important to talk to your healthcare provider before starting any new exercise program. Avoid alcohol, tobacco, and drugs. These substances can be harmful to your developing baby and should be avoided during pregnancy. Manage stress. Pregnancy can be a stressful time, but managing stress is important for your health and the health of your baby. Try relaxation techniques, such as deep breathing or meditation, to help reduce stress. Stay informed. Learn as much as you can about pregnancy and childbirth. Read books, take classes, and talk to your healthcare provider about any questions or concerns you may have. Remember to listen to your body, take things one day at a time, and seek medical advice if you have any concerns. Congratulations on starting this exciting journey towards motherhood. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are posted.